Hi guys, it's Leah. Welcome back to Mommy in the Moment. If you haven't, take a second to subscribe right down here so that you don't miss any of the videos I'm putting out on motherhood and being a physician, pregnancy, all kinds of good stuff coming out. So this video is about postpartum care and how you can help to optimize your postpartum care. We're going to go over 6 things that you should ask your physician when you go for your postpartum visit. The American College of Obstetricians and Gynecologists, or ACOG for short, has really been focusing on helping patients and physicians to optimize the postpartum period to increase maternal health, decrease complications, and just help women to do better in pregnancy. So one thing that we don't realize is that your postpartum care actually starts before you deliver. So your physician should really give you an idea, if they can, based on your current pregnancy status, should you wait 6 weeks to come back? Maybe you should come back in 1 week. Maybe you should come back in 2 weeks. So ask before you deliver, is there any reason for me to make my appointment sooner? That's kind of our prologue, our prelude. So the first question you should ask when you go for your postpartum visit are, were there any concerns with my pregnancy? Was there anything about my pregnancy, 1, that makes me high risk for future pregnancies, or 2, that makes me high risk for normal medical conditions later? Did you have elevated blood pressure? Did you have preeclampsia? Did you deliver early? Either did we induce you early for some reason, or did you just go into labor before your due date? These are things that you should know so that you can get the appropriate follow-up between pregnancies and also have the appropriate attention during your next pregnancy. Pregnancy spacing is a big deal. So we want to make sure that you get your body enough time to heal, physically heal, but also replenish your nutrients, your iron, your calcium, your minerals, all these things that kind of get zapped during pregnancy and breastfeeding if you're going to breastfeed your baby. We recommend usually 18 to 24 months between deliveries. And so you can talk to your doctor about, how do I space my pregnancies? What is a really good, reliable way to keep me from getting pregnant until I'm ready? And they can discuss your medical history and what sort of birth control or what options would be the best for you. Your doctor will usually do a physical exam to make sure that you're healing well and that you're not experiencing any complications that are common in the postpartum period. So whether you had a miscarriage, whether you had a vaginal delivery or a C-section, we should be making sure that any stitches that you had are healing well, that your pelvic floor is doing well, and that we're doing an exam to look for signs of complications. So are you eating and drinking well? Is your belly poked out and distended more than we would expect for the postpartum period? Are you having swelling in your legs that's abnormal, one side greater than the other? Any shortness of breath, things like that could point to serious pregnancy complications. These are all things that we're looking for in the postpartum period. Infant feeding. So whether you decide to breastfeed or formula feed, making sure that the health of your breasts is attended to is super important. I always joke with people that breastfeeding is one of the hardest natural things that you'll ever do, especially the first time you do it. Some people take to it really easily. With my son, my first, I almost quit. And I say, my friend Ashley, you saved me from this. But make sure that you're asking questions about breastfeeding if you're having any complications. Even if your physician is not trained in as a lactation consultant, we have resources so we can point you in the right direction, even if they're not able to give you the information themselves. So make sure you discuss how you're feeding your baby. If you're not breastfeeding, are you dealing with engorgement? Are you dealing with a lot of pain? Those are things to discuss when you go. Mood and adjustment. So it's really, really super common to have some sort of mood fluctuation after pregnancy. You have a whole new human that you're taking care of. If you had a pregnancy loss, then definitely you're going to have some adjustments in your mood. And there's small fluctuations. You can have postpartum blues, you can have all-out postpartum depression, and you can have postpartum anxiety as well, which is something that's a little bit less talked about, but still very, very common. So make sure you ask your doctor, is there anything that I can do to optimize my mood? If you're having difficulty, let them know. Don't keep it to yourself. Don't suffer in silence. Don't wonder if it's okay or wonder if it's normal. Ask them. Please, please, please ask, because this is the only way that you're going to be able to get help. So to ask, is my mood normal? Is this adjustment normal? Are these feelings that I'm having normal? And is there anything I can do to optimize it? Last but not least, make sure that you ask, am I ready to return to normal activities? And talk about just activities of daily living, returning to work, returning to intimacy or sex with your partner. These are all things that your physician should give you advice about to make sure that you personally are healing well and ready to go back. Hopefully this was helpful. The postpartum visit is super duper important, and I want you to get the most out of it. So I want you to know what to ask your physician and make sure that there's no stone unturned. Obviously, if you have questions that I didn't address, make sure you talk about it as well. I hope this was helpful. Definitely subscribe to the channel. Comment down below if there's anything that you feel like I left out, anything that I missed. I think it's really important that we build a community where not just the videos are helpful, but the comments down below are helpful. So definitely let me know what other things you think about when you talk about postpartum care. All right, guys, I'll see you in the next one. Bye.